Hi, my name is Brianna McCanns, and today I'll be presenting about hallucinogen or psychedelic drugs. Hallucinogens are a diverse group of substances that alter one's senses, thoughts, and feelings. These drugs cause hallucinations and other similar effects. These drugs are commonly referred to as psychoactive substances and are split into three categories: classic, dissociative, and plant hallucinogens. The types of hallucinogens are classic hallucinogens, which include LSD, plant hallucinogens, which include marijuana and mushrooms, dissociative drugs, which include PCP. Some examples of hallucinogens are psilocybin or magic mushrooms, which are commonly found in Mexico and in parts of the United States. These are commonly taken orally and absorbed through the intestinal lining. Another common hallucinogen is PCP. This drug was developed in the 1950s as an anesthetic drug for surgery, but is no longer used on the market due to serious side effects. It is commonly found in capsules, such as in this picture, and in white powder, such as in the capsules. Another common hallucinogen is LSD, or lysergic acid diethylamide. LSD was created to study the biochemistry of psychosis, and another common hallucinogen drug is DXM. DXM is a cough suppressant drug that is commonly used in a substance called lean. It is when the DXM is mixed with a substance like Sprite, and sometimes adolescents do mix these substances and put candy like Jolly Ranchers into them. Another common hallucinogen drug is ketamine. Ketamine is a surgical anesthetic for humans and animals, and it is also a psychotherapy that is being used in the United States. Another hallucinogen drug that is commonly used is marijuana. Marijuana is the most commonly used hallucinogen drug in the United States. Peyote is also a commonly used hallucinogen drug that is used by Native Americans in ceremonies. Another commonly used hallucinogen is salvia, which is commonly found throughout Mexico, and it is used in herbal teas. Here are some of the routes of administration for hallucinogen drugs. They are commonly taken orally and absorbed through the mucous membrane. They can also be taken nasally, intravenously, or smoked. Some of the effects of hallucinogen drugs begin within the first 20 to 90 minutes of the first dose. These drugs affect the central nervous system and hormones such as serotonin, dopamine, and norepinephrine. The effects of these drugs include hallucinations and sensory and emotional distortions. Some possible side effects of these drugs include schizophrenic-like psychosis that may possibly be a long-term effect. And it takes 100 to 2 micrograms of a hallucinogen drug to alter one's senses, and the feeling of altered senses begins within 30 minutes of the first dose. Some effects of hallucinogen drugs include the stages of sensory experience, which 1 is the heightened or exaggerated senses, 2, the feeling of loss of control, 3, self-reflection, and the fourth stage includes the feeling of loss of one's identity. Some short-term effects of hallucinogen drugs include nausea within the first 30 minutes, the feeling of altered senses, an increased heart rate, blood pressure, respiratory rate, and body temperature, intensified emotion and sensory experiences, synesthesia, which is the crossover phenomenon of senses, which includes hearing colors and seeing sounds. Other short-term effects include the loss of one's appetite, dry mouth, sleeping problems, spiritual experiences or awakenings, the feeling of relaxation, uncoordinated movements, excessive sweating, and panic. Other short-term effects are paranoia, which is the extreme or unreasonable distrust of others. Psychosis is another short-term effect, which is the distorted thinking or feeling of being detached from reality. Bizarre behaviors are also a possible short-term effect. Some physiological effects of hallucinogen drugs are hallucination, stimulation, depression, anesthesia, and analgesia. Some psychological effects of hallucinogen drugs are the feeling of strength or power, invulnerability, perceptual distortions, and paranoia. Some possible long-term effects of hallucinogen drugs are speech problems, memory loss, weight loss, anxiety, depression, and suicidal thoughts. Others include personality deficits. Two other possible long-term effects include long-term or persistent psychosis, which is a series of continuing mental problems that include visual disturbances, disorganized thinking, paranoia, and mood changes. The second long-term side effect of hallucinogen drugs are hallucinogen persisting perception disorder, or HPPD, which is the reoccurrence of certain drug experiences such as hallucinations or other visual disturbances, and this is the flashbacks of the drug effects without warning, and this can occur within a few days or after a few years of the drug use. Are hallucinogens addictive? The answer is yes, some hallucinogens are addictive, and a person may develop an addiction to hallucinogen drugs like PCP. Other hallucinogens are not addictive, but they do build tolerance to other drugs and other hallucinogen drugs. Hallucinogens as medication. Hallucinogens and psychedelics are being used as medication in the United States and other countries. A common used hallucinogen drug in the United States is ketamine. It is used as an anesthetic for painful medical procedures for humans and animals, and back in 2019, it was approved as a psychotherapy drug for severe depression. It is being used currently for people who don't respond to other medication or treatments for depression, and healthcare providers do believe hallucinogen and psychedelic drugs can be used as a psychotherapy. At the moment, hallucinogens are a treatment for severe depression, alcoholism, autism, schizophrenia, and other mental and physical disorders. Some associated risks and consequences of hallucinogens are the risk for a bad trip or adverse effects such as schizophrenic-like psychosis. Other risks associated are the long-term effects such as HPPD or long-term psychosis, and other associated risks are the unpleasant side effects such as muscle spasms, the loss of coordination, convulsions, and unconsciousness, aggressive, hostile, and violent behavior, the catatotic syndrome, which means users fall into a zombie-like state. An example of this is the event that occurred in Florida where a man on bath salts or PCP ate another man's face. Another associated risk or consequence is dependence or addiction, being a harm to yourself or others, and suicide. Data revealed that marijuana is the most commonly used hallucinogen, and according to a study in 2020, it was at a peak of an all-time high and the most commonly used hallucinogen in the United States. Microdosing is a common behavior that has grown popular on college campuses and among the college student population. The use of hallucinogen drugs is often influenced by peers and has continued to increase over the years. And in 2020, the annual use of hallucinogen drugs was 9.8% of the population in the United States. A study revealed in 2010 that males are more likely to engage in using hallucinogen or psychedelic drugs than females, and the use of psychedelic drugs does increase as a person gets older. Thank you, and I hope you enjoyed this presentation. Here are some of my resources.